All right, so this is the second portion of the Test 2 review study. So the nurse needs to closely monitor the O2 status of an older adult undergoing general anesthesia because of which age-related changes. So the most appropriate response is the diminished respiratory muscle strength may cause poor chest expansion. And that's because we know, some of the changes as patients get older, the changes of the thoracic structure, diminished muscle strength, the thoracic curvature changes a little bit, the reduction in the cilia. So if they have poor chest expansion, we anticipate problems with oxygenation, post-op pulmonary complications. So we're going to be closely monitoring these patients' oxygen respiratory status. The nurse determines that an older adult patient is at risk for infection due to decreased immunity. Which plan of care best addresses the prevention of infection for these patients? So it's encourage the patient to stay up to date on all vaccinations. So A, to inform the patient of the importance of finishing the entire dose of antibiotics is appropriate as far as reducing multi-drug resistant organisms. Scheduling patients to get their annual TB test is more about just screening. It's not prevention. Creating an exercise routine to run 45 minutes every day is okay, but I don't know if it's in regards to the older adult patients. So the best response is up to date on vaccinations. So which nursing intervention is most effective in preventing hospital-acquired pneumonia in an older adult? So the best response is going to be to assist the patient to cough, turn, and deep breathe every 2 hours. So obviously discontinuing humidification, that's not appropriate because we know that that's not going to allow our secretions to be thin, helping patients to cough them out. Monitoring O2 sats and auscultation of lung bases isn't wrong. It just has nothing to do with preventing hospital-acquired pneumonia. Decreased fluid intake to 300 a shift is not really appropriate. That's only about 600 milliliters of fluid a day, which is not the average. So from the oxygenation chapter, how to prevent hospitalized acquired pneumonia is ambulation, assisting the patient to cough, turn, and deep breathe, intake of fluids. So the nurse is caring for a patient who has an indwelling urinary catheter or Foley catheter. The nurse teaches the patient that the urine collection bag should be kept below the level of the pelvis or below the bladder, which is true. It's one of the most important things that we can do when the patient has a Foley catheter in to prevent catheter-associated UTIs, in addition to hygiene, pericare, limiting how long the duration the catheter is in, making sure there are no kinks, using a stat lock. So a confused patient asked to use the bathroom even though the patient was gone 30 minutes earlier. So what should the nurse do? We know we're not going to put a Foley catheter in, right? We're going to start with the least invasive method first, okay? We want to reduce catheter-associated UTIs. This patient is confused. It wouldn't tell us that in the scenario if it wasn't important, okay? So we're probably not going to be able to persuade the patient, and reminding them isn't going to be appropriate either if there's confusion. So because we worry about safety, we're going to take the patient to the bathroom again, even if it was 30 minutes earlier. So which patient statement indicates the need for nursing education about vitamins? So vitamins can be taken without the fear of toxic effects, which we know is untrue. Both fat-soluble and water-soluble have the ability to be toxic if they're taken too much. Okay? It's true. If vitamins, you don't necessarily need to take supplements if you eat a well-balanced diet, if you get them from fresh fruits, vegetables. No vitamins are manufactured by the body, and there's no change in vitamins as you get older, maybe just decreased overall food intake. The nurse is working in a nursing home with a large population of older adults. Which factor related to aging influences the nutritional status of older adults? So it's going to be deterioration in taste perception. Which we know is true of older patients as they do age. Okay, they have a decreased need for calories. I don't think there's any alteration in the production of gastric acid. If anything, it might be decreased. They don't necessarily need an increased milk intake. So a patient is experiencing diarrhea and needs to replace their potassium. The nurse identifies that additional teaching is necessary when the patient says, I should increase my intake of. The appropriate answer, although I have bananas there, is warm tea. Okay. All orange juice, bananas, and raisins all have potassium. So if we want to increase intake of potassium, then we would need to increase on all of those. But warm tea does not have any potassium in it. The patient with cancer is concerned about having a rapid weight loss and asks why this occurs. The nurse bases a response on the fact that cancer increases metabolic demands, right? So cancer cells actually, consume much more of the calories that we provide to patients who have cancer or are receiving cancer treatments. So their metabolic demands are increased, they change. Okay, so that's why there's weight loss despite eating. Weight loss despite making any changes in food intake. Okay, so the cancer cells are much more aggressive than our regular cells. To prevent a pulmonary embolus in a client on bed rest, the nurse should. The most appropriate answer is to teach the client to move the legs when they're in bed if they're on bed rest. Limiting the client's fluid intake is inappropriate. We want to encourage it because increased viscosity, like if the patient becomes dehydrated, is a risk factor for VTE. Encouraging deep breathing and coughing has nothing to do with preventing a pulmonary embolus or DVT. Using the knee latch on the bed has nothing to do with it. We want to prevent DVT formation, which is thus going to prevent pulmonary embolus. So exercising, early ambulation, early range of motion. The nurse understands that in the absence of pathology, a client's respiratory center is stimulated by. Most appropriate response is carbon dioxide. So yes, low oxygen, low pH, high CO2, which is carbon dioxide, all stimulate the respiratory center. It's what stimulates us to breathe. It sends the messages through our chemoreceptors to our brainstem. Back, that message is sent then out to the phrenic nerve to stimulate our respiratory muscles to breathe. Carbon dioxide elevations in that is much stronger of a stimulus than oxygen in somebody who doesn't have lung disease. So an independent nursing measure that would be helpful in preventing the accumulation of secretions in a client who had general anesthesia would be to frequent changes of positions. Postural drainage and cupping is more appropriate with patients who have long-term complications. This is a patient right after surgery coming out of general anesthesia. We're never going to start with nasotracheal or nasopharyngeal suctioning first. Okay, we're always going to try much more easy, convenient interventions first. So frequent changes, moving in bed, sitting up, position changes. When teaching a female client with recurrent UTIs, the nurse states that most women are susceptible because it's the length of their urethra. We know it's shorter and it's in closer proximity to the anus. A 30-year-old female is admitted for an elective surgical procedure. Which information obtained by the nurse during the pre-op assessment is most important to report to the anesthesiologist before surgery? So it's going to be the patient's statement that her last menstrual period was 8 weeks previously. So the patient's lack of knowledge about pain control is a nurse's responsibility. The patient's history of a post-op infection following a prior cholecystectomy may be important, but not as important as the fact that the patient could be pregnant. The patient's concerned that she will be unable to care for her children postoperatively. Definitely a concern, but not the most important. The surgical unit nurse has just received a patient with a history of smoking from the PACU. Which action is most important at this time? Remember, airway, breathing, circulation. So we want to listen to this patient's lungs, hear what they sound like. Are they diminished? Is there a lot of rhonchi? Is there any wheezing? Okay. Obtaining the patient's blood pressure and temperature is not inappropriate, but right, we said we need to answer our questions based on the context of the question. So if it talks about a patient that has a history of smoking, we're fixated on the respiratory component. We're not going to remind the patient about the harmful effects of smoking at this time. We might do a nicotine patch, but not right now. The nurse obtains a health history from a patient who is scheduled for elective hip surgery in 1 week. The patient reports the use of garlic and ginkgo biloba. Which action by the nurse is most appropriate? So it's going to be to discuss the herb and supplement use with the patient's healthcare provider. I think to determine if there's interactions with anesthetic agents, that's dependent on the anesthesiologist. Teach the patient that these products may be continued preoperatively. We really don't know. We need to follow up with the healthcare provider. We don't know if they should stop. Which topic is most important for the nurse to discuss preoperatively with a patient who is scheduled for an abdominal surgery for an open cholecystectomy? So care for the surgical incision, yes, important. Medications used during, that's usually not something that's discussed. That's kind of the anesthesiologist's preference, the CRNA of what anesthetics they're using. Deep breathing and coughing, and oral antibiotic therapy after discharge. Again, airway, breathing, circulation. We are really going to focus on deep breathing and coughing because this patient is having an open gallbladder removal, an open technique to the abdomen. So we anticipate some issues with pain, and the pain could lead to some respiratory problems if these patients don't want to be breathing. Take coughing. The nurse interviews a patient scheduled to undergo general anesthesia for a hernia repair. Which information is most important to communicate to the surgeon and anesthesiologist before surgery? And remember, we're answering based on importance and the context of the question. So the patient drinks coffee before going to work, okay? The patient takes aspirin daily but stopped 10 days ago. That's a long time. The patient drank 4 ounces of apple juice 3 hours before coming to the hospital. Yeah, I'm concerned. We're definitely going to inform that. But the fact that the patient's father died after receiving general anesthesia for abdominal surgery clues me into possibly there's a genetic or family history with allergic reactions with anesthesia, like malignant hyperthermia. In the PACU, a patient's vital signs are 116/72, pulse 74, respirations 12, and SpO2 91%. Now we know we typically like them greater than 92, 93, so that's on the marginal side. The patient is sleepy but awakens easily. Which action should the nurse take first? First thing we're going to do is we're going to encourage this patient to take some deep breaths, get them to cough, sit them up a little bit higher, right? We want them breathing deep. We want them to increase their respiratory rate, increase their stats. So the nurse assists a patient on the first postoperative day to ambulate, cough, deep breathe, and turn. Which action by the nurse is most helpful? All right, so this is a first day postoperative patient. So we anticipate, regardless of the type of surgery, a little bit of pain, right? So what's the best thing that we can do to make their activities, exercise most effective? Give them pain medications, right? So a patient is transferred from the PACU to the clinical unit. Which action by the nurse on the clinical unit should be performed first? Out of all of those responses, it's take the patient's vital signs: airway, breathing, circulation. We care about all those other things, but remember we said things can happen, variances in vital signs from unit to unit. We need to check on our patients' priorities. A patient who is just waking up after having a hip replacement surgery is agitated and confused. Which action should the nurse take first? Okay, so this patient is just waking up, had surgery, and now they're agitated and confused. All right, so the thing that I'm going to look to do, because I know that sometimes anesthesia, surgery can cause some confusion and agitation, but I also know hypoxia can lead to mental status changes, agitations. I'm going to check their O2 sats. And it's also because I know after surgery, waking up for anesthesia, patients are at risk for problems with airway and breathing. The nurse assesses a patient who had a total abdominal hysterectomy 2 days ago. Which information about the patient is most important to communicate to the healthcare provider? Right, so the correct response is the right calf is swollen, warm, and painful, right? So we suspect maybe DVT. The patient's temperature is 100.3, low grade, so we maybe anticipate that this could be just post-op inflammation, right? The 24-hour intake is 600 greater than the output. It might be because the patient was a little dehydrated after surgery, lost some fluid in the operating room, maybe lost a little bit of blood. So we need to kind of recoup some of the losses. The patient complains of abdominal pain, level of 6 to 10. Yeah, I care. We want to take care of that. We want our patients to be comfortable. But I feel like the possibilities of a clot VTE is much more important than a pain of 6 out of 10. The nurse working in the PACU notes that a patient who has just been transported from the OR is shivering and has a body temperature of 96.5. So hypothermic. What action should the nurse take? We're going to put a warm blanket on them, right? Forced air. Change the environmental temperature in the room. Warmed IV fluids. After receiving change of shift report about the post-op patients, which patient should the nurse assess first? So let's go through these here. So an obese patient who had abdominal surgery 3 days ago and whose wound edges are separating. So we said our patients who are obese and have a lot of adipose tissue, increased risk for dehiscence. The wound edges are separated. We're concerned about this. A patient who has 30 mLs of sanguineous drainage in the wound drain 10 hours after hip replacement surgery. That's not a lot at all. It's a little tiny cup. A patient who has bibasilar crackles and a temperature of 100 on the first day post-op after chest surgery. So this patient, has a low-grade temp. So what they probably need to be doing is using their incentive spirometer, doing a lot more coughing and deep breathing, moving. A patient who continues to have incisional pain 15 minutes after giving the patient Vicodin. Well, 15 minutes is not a long time to wait for the pain medication to kick in. So because of, the risks of obese patients and having a dehiscence with evisceration, that's our priority. Okay? That's a big overall concept, the big picture. I know we talk a lot about airway, breathing, circulation, but I'm more concerned about the prospect of a dehiscence and evisceration than somebody with a little bit of atelectasis or post-op inflammation. So which action most effectively demonstrates that a new staff member understands the role of scrub nurse? So these patients, these individuals, because they're sterile and they scrub in, they're going to keep both hands above the operating table, right? All of those other things are more the role of the circulating nurse, documenting, labeling specimens, transporting the patient. While in the holding area, a patient reveals to the nurse that his father had a high fever after surgery. Which action by the nurse is priority? Okay, what's our thought process, right? Malignant hyperthermia. So we're going to alert the anesthesia care provider of the family member's reaction to surgery. That's the most important thing. We might put a medical alert sticker on the front, closely monitor them, maybe give them Tylenol, but the most appropriate action is to notify the anesthesiologist. So which action included in the perioperative plan of care can the charge nurse delegate to a surgical tech? Right, so pass sterile instruments and supplies to the surgeon. That's their role. Surgical technologists they're not nurses, so they're not going to teach the patient. They're not going to monitor them and interpret the patient's vital signs and variations with the ECG rhythm, and they're not going to give reports. Okay, so that's typically the surgical technologist's role, is pass sterile instruments and supplies to the surgeon. So when caring for a patient who has received general anesthetic, the nurse knows red raised wheels of the patient's arms. Which action should the nurse take immediately? So we're going to notify the anesthesia provider, right, because we're concerned about an allergic reaction. So which action will the nurse include in the surgical timeout procedure before surgery, right? This is a process that we're going to do to prevent operating on the wrong patient, the wrong extremity, wrong vicinity, right? So what are things that we're going to do? So we're going to have the surgeon identify the patient. Who is this? We're going to have the patient, if they're awake, alert, state their name and date of birth. And we're also going to verify the patient's ID band number. We're going to look at it. Okay? So it's a timeout procedure, making sure that we know what we're doing, it's the right patient and the right time.